Okay, so I'm here at another patient station. I've been asked by one of my coworkers to do their independent double check. So I'm gonna do that now. I've come over to the patient. I've asked them how they were doing, how they were feeling, if there were any concerns. The patient has stated they're fine. I've also visualized the access to make sure that that is exposed and there's no issues. I've done the tug test, made sure things are secure. And I have also verified that the patient's name on the card and on the machine screen is the same as what's on the EMR screen. So I've checked that the patient is doing well. I've looked and assessed their access. I'm now going to eyeball the lines, the extracorporeal circuit, to make sure there's no visible leaks. I'm going to follow the lines from the access through to make sure that the placement of the lines is correct. All clamps are clamped. Checking for any sources of air, tightening any connections that need to be tightened, and checking the level in the venous bubble chamber to be sure that it is at an appropriate level and that there's no obvious signs of air in the circuit. Next thing I'm going to do is I am going to go to hemo session. I am going to go to the pre-dialysis screen and I am going to read the patient assessment. Okay, so I am seeing here that they are going to go for the full goal today, blood pressure permitting. It looks like they've noted quite a bit of peripheral edema on the ankles, and they're also stating that the patient doesn't wish to go for any extra fluid. So they are indeed going for a goal of 2.3 today, and I can verify that on the screen. And I'm just going to check the math. So measured weight and target weight. I'm making sure to verify that the total fluid administration seems to make sense. So that math seems to make sense to me. Blood pressures are recorded. And again, I'm coming over here and I'm ensuring that everything makes sense in checking the math to make sure the UF goal is programmed properly. If the patient is receiving anything via an IV pump, medication, or anticoagulation, I would check those orders and verify that they've been programmed properly on the IV pump. I am now going to go to the medication list, and I'm just going to verify that the medications that have been ordered today have been given. And it looks like this patient has received their anticoagulation, and it looks like they were due for iron today, which I can see has also been signed off by my coworker. So now that I've completed my independent double check, I am going to go to the pre-dialysis screen, assess, and I am going to tick off that I have completed the independent double check. Please remember that independent double checks are a requirement, and I am required to do the independent double checks for my coworkers, just as they are responsible to do the independent double checks for me.